So this is the pathogenesis of periodontal disease. So pathogenesis of periodontal disease is the process by which periodontal disease develops, and this consists of 4 histological stages: initial lesion, early lesion, established lesion, and advanced lesion. So a couple bacteria that are associated with the pathogenesis of periodontal disease are P. gingivalis, Tannerella forsythia, and T. denticola. These are the 3 red complex bacteria. They're all gram-negative and anaerobic. A couple other bacteria that are associated with pathogenesis of periodontal disease are the Fusobacterium nucleatum, which are the bridging species, and Aggregatibacter actinomycomatons. These are gram-negative facultative anaerobes. So the first stage of the pathogenesis of periodontal disease is the initial lesion. In this stage, we can see bacterial accumulation at the gingival margin. During this stage, biochemical mediators release PNMs to go to the site of the bacteria to try and destroy the bacteria. During this stage, we don't see a lot of inflammation. The gingiva appears mostly healthy at this stage. The second stage of the pathogenesis of periodontal disease is the early lesion, also known as early gingivitis. In this stage, we can see bacteria continue to mature. T cells and macrophages enter at this stage to release mediators to try and help destroy that bacteria. Blood vessels also become more permeable, which causes more tissue damage in this stage. In this stage, there is a loss of collagen, and we can see redness and swelling at this stage.
We're now looking at stage 3. We're at the established lesion, also the established gingivitis. This is where the biofilm also starts to extend subgingivally. The B cells and plasma cells start to enter the epithelium. This subgingivally also causes a strong immune response. All of this triggers a lot of our PMNs, our leukocytes, our plasmacytes, all to migrate at the site. This is where it all starts to get very severe. Your plasma cells release MMPs. MMPs breaks down collagen and causes the disease. At this stage, it can be reversible, as you are starting to see a lot of redness and swelling very prominent at this time. Puts you at a higher risk of developing perio long term. We're now at stage 4. This is our advanced lesion. This is our most serious type. It all starts out with an over-interactive immune system. The cementum really starts to get infected, especially down that root with all that subgingival biofilm. It starts to eventually reabsorb the cementum. Your periodontal ligaments that hold your tooth to the bone is starting to get destroyed. Those teeth really become loose, filled with pus. You start having bad breath. Inadequate home care really also takes a big role in this. At this stage, the damage is irreversible. It will result in a lot of deep cleaning, some SRPs, and eventually surgery and tooth and bone loss. We now are looking at your main risk factors for perio. These include smoking, age, a lot of systemic diseases, which includes diabetes mellitus, your poor oral home care with that advanced biofilm accumulation. You have that stress, believe it or not. A lot of certain medications can cause perio with your xerostomia and stuff like that, and also obesity. And then some signs and destruction of perio. You really just have a lot of noticeably red gums. They bleed easily, especially in treatment, so you just have to be careful with that. The gums also start to separate from the teeth, that pocket, more inflammation. that pocket really starts to get deep there. And really it's just broken down by bacterial toxins, and your immune system really declines. Your cementum is also weakened by those enzymes, such as your osteoclasts that are activated by chronic inflammation. It results in permanent bone loss. The gums start to recede from the teeth, leading to recession. Your root is very sensitive and becomes visible. And they eventually fall out if they are left untreated.